or catching the replay as we redo episode number 141 of the Wake Up Everybody's series. We're going to be talking about COVID this morning, y'all. So excited to have you all back with us. Definitely important to redo our presentation and to make sure we bring the information that was brought and make sure it is delivered fully and clearly and without interruption. So we are excited to be on. Hello to Facebook, hello to YouTube, hello to everybody who's joining us in the Zoom space, and shout out to my admin team this morning.
All right. So, Nigel, if we could put up the slide and then glide into the intro. Oh, good morning, Imani.
Great morning. Good morning.
Good morning. Good morning. Thanks for joining us.
Sound like you still groggy, Imani.
I totally am. But I'm here.
She sounds just mellow and calm to me.
Does she need anything to fully participate?
No, so just some listening ears. Maybe if you want to bring a pen and paper to jot down some notes, definitely be prepared to chime in if you have questions or response to anything that I have to say. But it's my intention for today to be informational as well as conversational. Morning, Joyce. Morning, Teresa. Morning, Dee.
Wake up, everybody. It's time to get up. Wake up, everybody. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. We're healing, we're dealing, we're growing. Together, together, releasing. We're teaching, we're moving. Together, together, we're learning, discerning, we're striving. Together, together, we're leading, connecting, transforming. Together, together.
All right, good morning, good morning, good morning again to the Wake Up family. I am Dr. Alexea, your triple board certified infectious disease physician, mom, speaker, author, coach, and breast cancer survivor thriver. I create healing pathways so that others experience total health and wellness, mind, body, and spirit. So I am going to load up my slide presentation, and for those of you who just joined us in the Zoom space and those of you who are joining us in the Facebook space, you don't need anything in particular for this session. However, if you do want to bring a pen and paper just to jot down some notes that may be helpful, I'm also inviting you all to chime in with your questions. Drop them in the chat. And the admin team will jump in when there's a pause or a transition and let me know about those questions. Again, I want it to be informational as well as conversational. So what prompted me to present this particular information is that we are all transitioning back to school. Many of us are transitioning back to workplaces and work environments as a result of the ongoing phased reopening around the country. And I wanted to make sure that, especially with our children returning to school, that we had the most up-to-date information, that we refresh ourselves on some of the social distancing measures, some of the precautions that we need to take to decrease the risk of spreading and acquiring a COVID-19 infection. Because depending on where you are in the country, especially those of us who are here in New York and in the tri-state area, our numbers have been really low. And I think with the numbers being low, there's been maybe a decrease in some of our level of vigilance. And we are anticipating a natural surge. And because we are going into new territory, returning children to full active school environments and returning to work in the midst of, some of us, in the midst of the COVID-19 pandemic, I wanted to make sure we reiterate that information. So just in case you're wondering what's happening with the numbers. So to date, 26.6 million cases of COVID-19 worldwide. And that number has gone up by like 2.2 million since a week ago when I initially did this presentation. So although some areas are experiencing decreased numbers, many areas of the world and of the country are continuing to experience increasing numbers of cases, and we're already seeing resurgences throughout much of the country and much of the world. Worldwide, there's been 875,000 deaths and counting, and in the United States alone, there has been 6.2 million cases. That number was 5.97 million cases last week, and over 185,000 deaths. The incidence of death is decreasing as we've gotten better with taking care of individuals who are hospitalized with the virus, but we're still seeing a significant amount of mortality, not just from COVID, but also from people being fearful of seeking care in the hospital environment as a result of COVID-19. So I was in a teleconference with a colleague that is a cardiologist last night, and she was saying that when she's seeing patients in the hospital for heart attacks that have nothing to do with COVID, their heart attack is so much further advanced than it would have been if the same individual had a heart attack a year ago or 2 years ago, because people are so fearful of entering the hospital environment and potentially acquiring a COVID-19 infection there. So that being said, I do want to say, please, if you do need medical attention, hospitals and urgent cares have the personal protective equipment they need. We have figured out how to screen and distance people even within the healthcare and hospital environment. And so you should not let this virus deter you from going to get medical attention that you need for something else. The same is true for your routine health screening. Go get your annual exam, go get your vaccines. Make sure you're going to get your routine cancer screenings like mammograms, colonoscopies. For the men out there, if you're dealing with or at risk for prostate cancer, make sure you're going to be screened for that. If there is any ongoing chronic medical care that you need, I encourage you to do that, because you want to keep your underlying disease states under control. You want to make sure you're maintaining your health and wellness so that in the event you're exposed to or acquire a COVID-19 infection, your body's in optimal condition to fight it. And you don't want to find yourself on the other side of this pandemic saying, I coulda, woulda, shoulda, gone to get this looked at. We're seeing cancers being diagnosed at much later stages than they ordinarily would have, because people are deferring screenings and people are not showing up for symptoms, again, out of fear. So healthcare providers are ready, willing, and able to take care of you and able to take care of you safely. So one of the things that I think people are sort of losing sight of is how this virus is transmitted. So COVID is transmitted by both what we call droplet transmission. So when we sneeze or cough and, you know, we have those little spittles that fly out onto people, even when we speak, right? We've all kind of had a little piece of saliva fly, those large droplets that you can see that can easily be captured on a camera or video, that land on your face, land on your nose, land in your eyes. Those droplets are larger than the airborne particles, which tend to be you know, much tinier, maybe even a tenth of the size of those droplets that can be transmitted. The difference is those droplets are what travel that, you know, 6, 8, or 10 feet that we talk about, but the airborne particles, those much smaller, tiny particles, and if you could see in the graphic, just to give you an idea, if the larger dot is a human hair could be 60 to 120 microns in size. These these airborne droplets, they're 5 microns in size. So much so significantly smaller than even just a single strand of hair. And what is important about those droplets is that they can linger and just float in the air for hours at a time, even upwards of 3 or 6 hours. If you're in a closed room or a space where there isn't any open windows or crosswinds, and they travel much further. So they can travel 10 or more feet. So that is why the social distancing rules are saying a minimum of 6 feet distance, even with mask on. But I'm here to tell you that this virus can be transmitted even at further distances, and you don't have to cough or sneeze to transmit those airborne particles. You could be speaking just as I am, and I could fill my entire bedroom that I'm in here in my home with infectious airborne particles. And then the next person that comes in, maybe one of those particles lands on their face or in their eyes or in their nose or mouth as they're in there breathing the air, or maybe it lands on the surface of my desk, or maybe I touch the doorknob and whomever comes behind me and touches those surfaces picks up those invisible droplets and particles and then touches their eyes, their nose, or their mouth, and then transmits the virus. So you know, close personal contact is a huge risk factor. So we know that household contact was really big. You know, we saw multiple people in one household acquire the infection. And so when you think about the return to school and work, of course, the school and work environment has to be much different than it was traditionally prior to the pandemic in order to decrease the risk of spread of the infection. Even with the types of measures that we have in place, nothing is perfect. And so you still do see a fair number of people becoming infected, even though they are taking the proper precautions. So who is at risk, or what underlying conditions would place someone at risk for having severe illness? And when we talk about severe illness, we're talking about the people who need oxygen support, the people who have trouble breathing, the people who end up hospitalized or in ICUs, going into respiratory failure and needing breathing support. Who is likely to develop severe illness? People with cancer. So cancer history in general is always a risk factor in the medical community. You could have had cancer 20 years ago. We will still put it at the top of the list when we talk about your past medical history and your risk factors for complications of any other disease state, or, you know, complications for what lands you in the hospital. Cancer patients who are actively undergoing cancer treatment, like getting chemotherapy and radiation therapy, because those suppress the immune system, they are also at an increased risk. And more of an increased risk compared to someone like myself who's on the other side of cancer treatment. People with chronic kidney disease, also chronic liver disease, chronic lung disease like COPD, chronic bronchitis. If you have chronic respiratory failure, you wear home oxygen. These are disease states that place you at risk for COVID-19 infection and severe illness. People who are immunocompromised or immunosuppressed, and that could be naturally, like you're born with a weak immune system, or you've acquired a weak immune system as a result of like an autoimmune disease, or again, cancer treatment that you've had in the past, or if you have a transplant, so like kidney transplants, liver transplants, pancreatic lung transplants. Whenever people get transplanted solid organs, they're given medications to suppress their immune system so that they don't reject the organ. It's a pretty huge risk factor for complications of COVID-19. Obesity. So being obese, so having a BMI of 30 or greater, also was a significant risk factor for people being hospitalized and going into respiratory failure as a result of COVID-19. And that is because being obese impacts your level of systemic inflammation. It is increased, and inflammation runs amok in the body in the midst of COVID-19. I've never seen labs like this in my entire medical career, even from medical school till now, where every single marker for systemic inflammation was not just elevated, like higher than I've ever seen in my career and through my education. So the amount of systemic inflammation that this virus has the ability to produce is unbelievable. And if your body is already in an inflammatory state, it's just going to grow out of control and damage the cells and damage the organs. People who have serious heart conditions, like have had heart attacks, have heart failure for any reason, or who have cardiomyopathy, that's what we call CHF, or congestive heart failure or chronic heart failure. Because this virus directly infects the muscle of the heart, affects the electrical pacemaker of the heart, like the natural cells that give the heart its natural rhythm and tell it to pump, those can be directly impacted by the virus. The heart muscle itself can swell, it can be damaged. And so we're seeing major heart failure and abnormal heart rhythms as a result of this virus. And so that can be a chronic condition that people are stuck with after they experience this infection. And they're seeing it even in patients who've not necessarily been hospitalized. So it's very important to keep an eye on your symptoms. And if you developed symptoms like chest pain, really great difficulty breathing, you really want to seek emergency medical attention. It could be the lung, it could be the heart, it could be both, and it's not a symptom to play around with. And then for those of us in Black and Brown communities, sickle cell anemia or sickle cell disease is a risk factor for multiple reasons. So sickle cell can impact the heart, it can impact the lungs because of the chronic circulatory changes. Also, people with sickle cell have what we call asplenia. So they either lose their spleen, it kind of shrinks or atrophies because of the circulatory issues, or they have it and it just doesn't work because of the nature of sickle cell. So not having a spleen makes you highly susceptible to sepsis due to any infection. So this is a huge risk factor and very important for our community specifically. So in terms of what are the symptoms, what does COVID-19 look like? One of the things is that we are about to enter into cough, cold, and flu season. And so it's hard to know, do I just have a run-of-the-mill cold or do I have COVID-19? And the only way to distinguish would be to seek medical attention and get a test. And I would say as we return to work and we return to school, it's imperative that we distinguish what our symptoms are due to, but also that we just like show up at the appropriate healthcare setting. So if your symptoms were very mild, like you're just having mild fevers and chills, you're having a cough, maybe you feel a little bit short of breath, but you're not in particular having difficulty breathing, like you can speak full sentences, in spite of any respiratory symptoms that you might be having, you're not having fits of cough where you can't catch your breath, you might seek medical attention in your primary care doctor's office. But of course, call ahead and report these symptoms so that they can prepare for you to be coming in, or they might, decide to assign you a telehealth visit so that you're not exposed to other patients in the office who may be sicker and at risk. Or, they may triage you and say, no, it sounds like maybe you need to go to an urgent care center. So fever, chills, cough, shortness of breath, difficulty breathing are symptoms of the infection. Fatigue, so just feeling generally tired, malaise, lethargic, having those flu-like symptoms, those muscle pains, joint pains, body aches, and headaches. One of the early symptoms that is sort of specific, not specific to COVID, but definitely a hallmark of this virus and a very early symptom, loss of taste or smell. And a lot of people had that as their first symptom before they even felt sick. So if you notice there's a shift in the way you're smelling things, or your ability to smell, or the way things taste to you, that's a red flag, and you need to find out how you can get evaluated for COVID-19. Sore throat, but of course, strep and other viruses can cause sore throat. So again, and bacteria can cause sore throat. The need to distinguish so you can get appropriate treatment for whichever condition is ailing you. And then congestion, nasal congestion, chest congestion, you can have runny nose, and COVID affects everything. It even affects the gut. So we've had many patients who presented with COVID-19, and it seemed like they had like those stomach viruses or those stomach flus where you get nausea, vomiting, diarrhea with abdominal cramping plus or minus fever. Do not mistake that because this isn't a respiratory symptom. That is not COVID. It could actually be COVID. So as we're preparing to return to work, I put this slide up because when the city and New York State started its reopening, it reopened based on what was an environment where people were least likely to transmit the infection. So construction, people are outdoors, they're working spread out. Retail was running, people could do curbside pickup at a restaurant or certain retail stores, but you couldn't physically enter into the stores, especially when the numbers were very high, because they didn't want crowding. And you wanted to limit the exposure of the employees and workers who were doing essential job functions so that we could all have what we needed. Surprisingly, hair salons and barbershops were opened in phase 2, but that required, getting your hair done, getting your hair cut requires a lot of like very close face-to-face contact. So I would have thought that would have gone into a later phase, but I think there was a balance of getting people back to work and keeping us all safe. But nonetheless, salons, barbershops, nail salons are all reopened for business, but everyone has pivoted, shifted, and have put barriers in place. Everyone is wearing masks, face shields, etc. Most businesses are screening your temperature and doing those healthcare questionnaires or those symptom questionnaires, and seeing if you travel to high-risk areas before letting you in. If you're answering yes to any of those questions, and you can look them up pretty much on any website, but I would direct you to the CDC website or the WHO, World Health Organization website, to look at those questions. Just take a self-assessment, self-screen, self-monitor before you go out and potentially expose someone. We are in phase 3 and entering into phase 4 with restaurants being open. So you can go sit down and eat at a restaurant. You can go shop at the mall. And if you're in the city where there's mass, in a city, anywhere, if you are in phase 3 of your reopening, you may be allowed to use public transportation. One of the things that I have said is that the fact that these things are open doesn't mean that they are safe or that they're not without risk. You still have to take isolation and social distancing precautions within these environments. So to me, it sends a mixed message, right? That these things are open and it gives people the false impression it's open, it must be safe, I should be able to go in there. I would say still definitely limit your exposure and time spent in these places as much as you can. So, and I would say, you know, take a calculated risk. So I think it was last weekend, I ate out at a restaurant, but I ate outside. I ate in the outdoor seating area. And I was really shocked because it was a really big restaurant and it was pretty much packed. And as we were walking through the restaurant with our mask on, of course, to go to the outdoor seating space, what I noticed is that everybody inside, like the patrons, they were just sitting at their tables unmasked, just talking up a storm. And in my head, I'm like, oh my gosh, this place is being filled with virus if anybody in there is infected, or even if one or two people in there are infected, and everybody's talking, laughing, breathing deeply, and just kind of very relaxed, eating. And I was, just concerned, like, is this whatever we're going to eat like that special for us to be taking a chance at a restaurant? So everything is like a risk versus benefit, right? And you want to weigh the risk versus the benefit. So the numbers are very low in my community and where I live, but they're not zero. So rather than go sit in a restaurant, I chose to sit outside in the fresh air in the hopes of minimizing my risk of exposure. So I'm certainly not saying that you can't do anything, but really know what's going on around you. Know what the numbers are in your area. Know if there's been any outbreaks linked to any particular environment, a particular restaurant or particular community or particular event or activity, so that you can help understand your risk. As schools are reopening, schools are definitely planning to take measures to keep children safe. So they're doing things like cohorting children. So keeping kids in smaller groups, keeping them in classrooms, and maybe having the teacher come to the classroom, or trying to minimize exposure to one another by limiting hall passing, splitting lunch periods where larger groups gather together. Other things that I've seen put in place, no use of lockers, eliminating textbooks and giving the students their own tablets or laptops so that their textbook is confined to their device and there's not shared use of things like textbooks and stuff like that that couldn't be well sanitized or sanitized between every single period. Of course, staying home or keeping your children home when they're exposed. I am a working parent, and I will tell you that I have been in previous years guilty of, my kid looks fine, isn't complaining, but maybe has a little fever, giving her some Tylenol and sending her to school with the mindset that whatever this is, she got it at school, I'm sending her back. And I know that is a common thing for parents to do. We've all been to school a little sick. We've all been told, don't you go to that nurse's office, but now is not the time for that. The stakes are so much greater, and we really not only are being responsible for the health of our own child, but the health of their peers, the health of their teachers and everyone working in the school building, and the health of everyone in a home who another child may be returning to. So we live commonly in multi-generational households. Everybody probably has a family member or a household contact that has some inherent risk for this virus, even if it's due to nothing more than age alone. So we want to make sure we keep our kids home when they're sick. We want to provide them with masks and face shields. If the school district doesn't, we want to get them in the habit of wearing them. And I always say parents need to model good mask behavior. So if as a parent, you wear your mask and you wash your hands, you admonish your children to not touch their faces, pick their nose, not pull their mask down, encourage them, let them know they're doing a great job when they keep that mask on and that they're keeping themselves and everybody safe, then our children are just likely to follow suit. Teach your children good respiratory etiquette. So if they are coughing or sneezing, either cough or sneeze into a tissue or a paper towel, or cough or sneeze into the crook of their elbow, rather than just sneeze into their hands. But if they do cough or sneeze, sanitize their hands or disinfect them with a disinfectant wipe or hand sanitizer if soap and water is not available. And then remember to utilize and stay behind the barriers and dividers.
Lexi,
Yes, ma'am.
there are comments on the chat, or a couple, and I also know that there are folks in the space that actually work in schools. Curious, because you're talking about the risk and people returning. Some folks haven't been in months. So I know Lori contributes to the growth and development of young people, and I'm sure there are others. But Lori, can you come off mute and just share, because you're posting and I want to hear what you have to share. And then Robin also wants to speak about this.
Oh, wonderful. I love it.
Let me see. Do we have to invite Lori?
Good morning.
Good morning.
So today's been my technical difficulties day, so I'm really getting to my phone. But I do work for a public school system, and our schools have been preparing and planning, and then we were so grateful for additional time to plan, because we've been keeping a close track on delivery of PPE to schools. There will be masks available for students and staff. The cleaning procedures and protocols are in place. Parents can opt, they've had the opportunity to opt in to school or opt for remote learning, but even when you opt into school, it doesn't mean you're going back to school the way it normally is.
Exactly.
It means that there will be very small class sized, masked and socially distanced in the classroom. I know you may have seen pictures of barriers that's not in our schools. I can say that. Unless a teacher, God bless teachers, unless a teacher's going to go in her pockets and purchase barriers for each of her students, or parents purchase barriers for each of those students. That's not something you're going to see. We're not expecting parents to go to school. We have strict limits on who's coming in, the number of people. It's 50% capacity, and this is being thought out very carefully. So there won't be sort of that casual, I'm just going to go and check on the school thing. Everyone's being scanned for temperature when they come in. There's an isolation room if anyone's showing any signs or symptoms of illness. There are lots of concerns. Of course, if you have young children, they learn through touch, through their senses. They're going to be so excited. We're going to have to really teach our children and grandchildren how to contain themselves. When they, like, how do we give hugs from afar? I remember when I was in a school, we used to say, we're going to say hi quietly, and we wiggle our finger instead of, like all the movements. Like, how do we create some new structures for connecting without touching? Without like talking really closely? Our children have got to learn a lot of new habits. They won't be eating in the lunchroom. There won't be this mass of children moving around. They're going to be pretty much in their classrooms for most of the day. We're going to be learning how to line up very differently and how to walk very differently through the halls. So movement around the building is limited. So there's probably going to be a lot of exercise taking place standing in your place, right? Or going outside and having spots, because we're not going to be able to, and let's be real, this is New York. We do not have, California weather all year. We're moving into the fall. It's going to get cold. I know in some of our neighborhoods, there's high incidence of asthma, and there are a lot of parents who are like, oh, don't send them outside to play today. They're asthma. And I know that if they don't get that fresh air, they're going to be sitting in there with that stifling mask on all day. And let me just say, I had to wear a mask for a number of hours the other day. God bless our first responders, essential workers, healthcare providers. It was tough. I don't care how cute your mask is. It is something impeding your free breathing. And I have asthma. So let's be real. This is not a good idea to have an asthmatic person wearing a mask all day. Those kids should probably be remote. And I know that we have parents who can't afford to do that. And we have, of course, our own health issues at home to consider. Who will be impacted by your children going to and coming from the outdoors? You know,
Exactly.
I remember my grandma saying, "You smell like outside," right?
Yep.
We don't want outside. We don't want outside to come in the house. You know, and it's a terrible thing to me because children need to socialize and connect and be out there. I admire those families who decided to double bubble so their kids had a social circle and were able to, and as adults, that they were able to socialize and maintain a level of security, that they were in this together and we're going to all maintain some safety for ourselves and our families. But once we go back outside, even the governor said, don't be surprised if we see the numbers go. And it freaked me out. Like, what do you mean, don't be surprised? Then why are we going back?
It's only a matter of time. And again, you know, they are trying to balance economy, balance education, balance even some people's, you know, social and emotional well-being with combating this virus. So we are fortunate in that we are returning to school, at least in New York, New Jersey, Connecticut, and the tri-state area, with the numbers being low, but they're not zero. And so that's where, you know, the honor system comes in. You know, hopefully no one feels like, you know, oh my gosh, I just got back to work and I can't miss a day, so I got to send these kids to school, even though, you know, somebody might have had symptoms. We have to think, we should always think so far beyond ourselves. But I mean, this is really a time where is even more imperative that we really think levels and levels and levels beyond ourselves in terms of who we could be impacting by sending our children back to school. So Denise Renee West from Facebook says, she's thinking of this. It's teaching children a new sense of socialization, and in an age of technology, they were already losing what real socialization is. Teaching kids how to unlearn what is natural for children is going to have long-term impacts on our society. So I say yes, but I also say no. So one of the things that I've heard so many people say is, oh, our children are suffering, our children are struggling, et cetera, et cetera. Now, granted, I know that my household or some of the households in my community is not necessarily a reflection of every household or every community, and everybody is operating with different means and different abilities to, and Robin, I'll get to you, different, you know, means, different environments, right? I go outside, I go into my big backyard, I go onto my big front lawn, I can, you know, my streets are huge. There's not, even when there's a lot of foot traffic, you know, it's just kind of understood. You cross the street and you're probably not going to cross somebody else's path for another block or two. I kind of feel free to move about my community, but I realize that that is entirely different than someone who's crossing a hallway, an elevator, navigating staircases, going through a lobby, you know, out in a community where there's just more, that is more densely populated, and then fighting the air pollution and all of these things that contribute to our poor outcomes. But the flip side of that is that, you know, with all of this technology, our children have been able to stay engaged and interact with one another. I had siblings, but my daughter's an only child, and so are many of her friends. I can't imagine if this happened in the 80s or 90s when I grew up and there was no Facebook Messenger, no FaceTime video, no WhatsApp, not, you know, our children some of our children have been able to see their friends. So like my daughter planned a movie night with her friend. You know, I was in the middle of a meeting. She just came downstairs and started popping popcorn. And I'm like, wow, I'm giving a talk here. This is what we doing? We popping popcorn? And I stormed upstairs ready to reprimand her for popping popcorn in the middle of my meeting. And when I got up there, she was sitting at the edge of the bed with the iPad on. She was eating her popcorn, and her best friend was on the other side of the camera eating her popcorn, and they planned a movie night together. They got on Netflix, dialed up the same movie, it started at the same time, and were engaged in a conversation about the movie, laughing and chatting together and seeing each other's faces. So for those of us who can utilize technology, I realize everyone can't. It is an important tool to maintain distance socialization. And you'd be surprised what these kids will come up with when they have certain access. Also, you do have to be careful. Like if I go to sleep and my daughter has the tablet, you know, I could wake up at some ungodly hour of the morning and she'll be up playing video games and talking to a friend too. So we have to, you know, make sure we have checks and balances in place with this technology, just like any other technology. So Robin, I'd love to hear from you now.
Hi, Lexi. Good morning.
Good morning.
I'm so glad that you are doing this this session again, because there's so many layers to this that I'm experiencing, everybody, but I am experiencing. I'm so glad that Lori got on to speak. As a union rep, my job is to advocate for and support the support staff in schools. And Lori is one of our members as a parent coordinator, but the support staff is not necessarily in, and they're called and others, but they're not necessarily in the plans that they're making in all of the schools. And so my members are really, really concerned. They have several own high-risk issues, but one of the cafeteria staff, those are my members, they have been working since this pandemic started. So they just established a new normal for them. And now the remote learning has ended. And so the people are coming back into the school. So the hysteria is starting all over again for them. But it's also on another level for those that are going into the school. Now, even though everything Lori said would represent the remote learning, right? But now you have the cafeteria, and Lori said they're not having lunch in the cafeterias, but now the burden and the overwhelm, the fear, all of that is really, really heightened and kicked up for the support staff, because if they're not serving lunches in the cafeteria, the designated eating space, now you have people who just established the new normal, who have to now figure out how they're going to get these lunches to the classrooms. And it falls on the cafeteria staff or the school aides. And that's not something that they would normally do, 5-story buildings, walking up the stairs. So it's so many levels to this. And I specifically wonder if, like so the parent coordinators usually have a budget, and I don't know how it will work. So maybe Lori could clarify that, but they have the ability to have workshops for parents, and they have a budget to do that. And it's like the parents need to have this type of thing happening, this communication that you're giving right now, from an outside source, somebody who's not the mayor, not the chancellor, not all of the people who's saying whatever everybody they're saying, but somebody. Everybody mad at. It's not going to work unless they hear it from an objective perspective, a medical expert at that, and someone who fits all of the categories, all of the criteria. You can relate to everything that they're going through, and then also give us this informed perspective. So I just wanted to put that in. And also, I have 2 asthmatic kids in my house that are not going back into the school system. So You know, we're not teachers. So that is
Exactly.
going to be a whole nother monkey, because now we have to figure out a new normal for them with remote learning.
Yeah. Yep. So it's definitely so many, like you said, so many levels and layers of the challenges. And, you know, schools and workplaces are trying to take measures to make this work. I totally, you know, get it from the perspective of these cafeteria workers who were in one confined, relatively protected space, right? They're behind the lunch counter. They're kind of in a separate room or space or behind a wall typically versus where the students are eating. And so now to say, okay, well, yes, prepare the lunches, box them up, and now navigate the entire building and go deliver to classrooms. That sounds scary as heck, I'm sure. But but what I will say, as a healthcare professional who has been, you know, in an 8x10 room with patients who had COVID, the personal protective equipment does work. And the teachers, the cafeteria staff, well, I'm not going to say the teachers, the cafeteria staff are going to have a relatively limited contact time and exposure with the students. When they looked at outbreaks of COVID-19 amongst hospital employees, apart from people who had high-risk direct patient contact, like the respiratory therapist, the people, the anesthesiologists, critical care workers putting breathing tubes in and, you know, applying the mask and the high flow oxygen, etc. When they looked at people like nursing aides or assistants, or like the janitorial staff, or because there was a lot of ancillary workers and staffs, phlebotomists, those kinds of folks in the hospital who also got sick from COVID-19, but they didn't necessarily do the most high-risk procedures. What they found, and they didn't necessarily have, you know, prolonged high-risk contact with patients. What they found was the staff was getting into trouble in the communal spaces. So what would happen is they would be diligent on the wards. Of course, they wore all the equipment in and out of the room. They washed their hands, they sanitized, they did all the right stuff. But then they would get to the break room and congregate without their mask on because they weren't in the medical space. They would get in the locker room and take their mask off, and they felt that that contributed to a lot of the spread of the virus amongst hospital employees and staff. So the same would be true for school workers, right? Compared to the worst case scenario, you're in the hospital on a COVID unit, right? You're in a relatively low risk space, because generally speaking, everybody in your space and in your environment should be healthy and should have been screened in some way or another. But we know that people who are asymptomatic carriers are going to sneak in. But if you, not sneak in, but wind up in the communal spaces. But if you're wearing your mask, wearing your face shield, practicing the hand hygiene, and not letting your guard down when you're in communal spaces like a break room or, you know, in the bathroom, things like that, you should ultimately decrease your risk of acquiring a COVID-19 infection. There are definitely going to be challenges because, like, well, how do I eat lunch? Or how do I take a break? You know, how do I take care of myself if these, you know, spaces potentially pose a risk? And it's just, you know, move quickly, swiftly, you know, and continue to maintain at least 6 feet of distance between yourself and your coworkers. You know, one of the things that they talked about in school budgets was like, do we have enough supplies and manpower to clean and disinfect these schools every day, overnight, get every surface? You know, imagine, you know, you being a custodial worker who cleans a school every night, but normally you're sweeping, you mop the floors, you clean up anything that's grossly soiled, and you're emptying trash bags and cleaning restrooms. Now all of a sudden you're expected to clean every touched surface of the building, every doorknob, every, you know, desktop, every, surface of the chair, anything that can be touched by multiple people, you're expected to clean and disinfect that. That requires a lot more manpower, a lot more time, and a lot more money. So lots of things in play that need to be considered. So when we're at school and work, and when we're gathering, you want to conduct health checks. And in school and work environments, they have to be done daily. So temperature screening, symptom checking, and then safely and respectfully doing that. So you don't want to violate anybody's, personal protected information by talking about these things, or, recording information and disseminating it through email. We want to do this in a way that is respectful of other people, especially, if somebody now appears to pose a risk. Maybe they traveled, maybe someone in their household was infected or sick, and you don't want other people to think, oh my gosh, this person is placing us at risk and now they're under attack. So we are well aware of the many types of school reopening models, and what you get is really dependent upon where you live and what is feasible in your community. So there's all distance or remote learning. There's the traditional school model where children are going to school 5 days a week. There's a hybrid model where students are in school and learning remotely. And that can be full-time, right? 2 separate cohorts of children to decrease the number of kids in a particular classroom, or a hybrid model where children may go to school every other day or 2 days a week in particular cohorts to minimize the time spent together in the classroom or face-to-face contact. So those are some of the measures that are in place, and we hope that those things continue to work well for our communities for as long as they're going to work, with the anticipation of a natural surge coming. So what else can we do beyond masks? What else can we do beyond socially distancing and isolating ourselves? Protect yourself from other respiratory illnesses and infections. So get your age-appropriate vaccines for respiratory illnesses, such as the flu and certain types of pneumonia. One of the things that I will say is that, in taking care of COVID patients, what we saw, and this is pretty predictable, is that folks who experience COVID-19 pneumonia or respiratory failure from COVID-19, which is a virus, often as they were experiencing prolonged illness and prolonged hospitalization, ended up with bacterial infections. And one of the most common bacterial infections we see post-virus, like post-flu, and we saw in many patients with COVID-19 was pneumococcal pneumonia. And people who are 65 and up, people who have chronic kidney disease, diabetes, smoke cigarettes, asthma, COPD, they qualify to get that vaccine from the ages of 19 to 64. And children, if they are receiving routine childhood vaccinations, also get pneumococcal pneumonia vaccines. So make sure you're up to date with your vaccines. Now is a great time to get into your pediatrician, to get into your primary care doctor, because right now the COVID numbers are low, and so you're less likely to be sitting in a waiting room with someone who had COVID if you're going in for your vaccines. So make sure you take care of yourself and you keep up with your routine health screenings and your routine health appointments. Make sure your blood pressure is controlled. Make sure your diabetes is under control. If you didn't already, just knowing that obesity is such a great risk factor, start a weight management plan, start changing up your diet, start exercising a little more regularly, especially while the weather is temperate, when we can get out and just go take that brisk walk 1 to 2 times a day. And depending on the density of people in your community, maybe that's with a mask, maybe that's without a mask. But don't let, other people being outside be an excuse for you not moving your body and not taking care of yourself. So just be informed. Yes, go ahead.
I'm sorry, Alexia, I just wanted to jump in and say that we are approaching the 8 o'clock hour.
Okay, so let's see. I'm a little under halfway through my slides, but for anybody who does have to hop off, thank you so much for hanging in there with us. If you haven't seen the second half of the presentation, please do catch the replay in the Wake Up community group so that you get the rest of the information, because there are some steps and some actions that we can take above and beyond our mask to help protect ourselves, and we're going to talk about that in this latter portion of the presentation. Nija will share my contact information in the chat, and definitely please do feel free to reach out to me with additional questions or tag me in the chat in the community with your questions. So that being said, I'm going to proceed. So what I'm going to say lastly before we sort of transition is, read the news or watch the news. Don't watch it to the point that it makes you sick and stressed, but make sure that you know what's going on around you in your community as in terms of the numbers of cases, the numbers of hospitalizations, the numbers of deaths. If those numbers are increasing, that's a signal that things are spiking again in your community. Tracy, I see your hand raised. Do you want to unmute and come on the screen?
Good morning.
Morning.
Question. So if I get the flu shot, will that limit my chances of getting COVID?
It won't impact your chance of getting COVID, but it would, of course, decrease your chance of getting the flu. And if you got the flu in spite of having a flu vaccine, it should decrease your risk of being hospitalized from the flu or dying from the flu. So the flu, we know, is seasonal. It comes every single year. Some seasons are much worse than others. And so, my goal when I'm wearing my primary care hat or my infectious disease hat and getting people vaccinated is to prevent unnecessary illness, missed days of work, spread of the infection in a household or community, decrease hospitalizations, and complications of being hospitalized, like bacteria, pneumonia. So we still have to protect ourselves from the flu and other viruses. And so every cough, cold, and flu season, we're always talking about hand washing, covering our coughs and sneezes, good respiratory etiquette. So one of my hopes is that, we may possibly see a decreased amount of flu because of the mask and the distancing and those measures to prevent the spread of COVID-19. But that being said, I still get my flu shot every year. So if there's no, contraindication, no absolute reason that you can't have one, or if you don't routinely get one, this would be a year I would absolutely consider that. It also may help your.
But I can still get the flu if I get the shot.
Not from the shot, but yes, there's no such thing as a perfect vaccine. So even if you got the flu, the vaccine should decrease your risk of being hospitalized, developing post-influenza pneumonia, or dying from the flu. I've had the flu with a flu shot on board and without a flu shot on board. I had the flu when I was 24, healthy, didn't have a flu shot because there was a shortage that particular year. And every team in the particular hospital I was working in got hit by the flu. It was like the flu was marching down the hall, taking teams out. I was sick for about 2.5, almost 3 weeks. I felt like I was going to die. The first week of my illness, I basically laid in my bed clinging to a bottle of ginger ale because that fixes everything. Doesn't fix anything.
Ginger ale or some fresh ginger might do the trick.
Yep. So,
and some turmeric.
Yep. At that time, I was just trying to keep sugar in my body, trying to keep hydrated and prevent, losing any fluids I had taken in.
Right.
But I was literally too sick to get up and get out of bed and drive myself to the hospital. It's the only reason I didn't go. I have subsequently had the flu at 35, 36, and I don't know if I had flu or mono at 37, but I had some nasty virus. But with the vaccine on board, I had a much shorter duration of illness. I was back up and running in like 3 days. Felt sick, felt terrible, but the period of time that I was sick was so much shorter. As a working person, no longer a student, I don't have 2.5, 3 weeks to be out of work. I have a staff that I employ. If I'm not working for 2.5, 3 weeks, they're not working. I can't afford for my kid to be sick 2.5, 3 weeks, and that impact our household. And so those are some of the other things that I consider when I am choosing to vaccinate. It's a personal choice, but there's a lot to consider above and beyond, do I get sick, or, the flu shot causes my arm to hurt? What are the benefits? So again, risk benefits. So for me, the benefits far outweigh the risk, but I'll admit I'm biased. I had that infection and it took me out, and I'm just not chancing it again. So,
right.
So any other questions on that?
No, I'm good. Thank you.
All right. Thank you so much for jumping in and asking that question. A lot of myths out there about the flu vaccine. A lot of people have questions about it. And so it's an important topic to cover, especially in the midst of COVID-19, because we anticipate the surge to occur right in the midst of cough, cold, and flu season. So what can we do, right? How can we prepare ourselves for this return to work? How can we prepare our bodies in the midst of COVID-19? So of course, we want to strengthen our immune system, right? So you just kind of think of your immune system in multiple levels or layers. So the first level of our immune system is our skin, our biggest organ, right? It literally keeps pathogens from entering our body. So just it's important to hydrate, to maintain your skin's health and integrity. It's important to take care of your skin with, moisturizers as well as diet. So eat healthy. And then when you think about kind of your internal immune system, so your white blood cells that fight infection, your circulating antibodies, they basically, when a pathogen gets in, like when it enters our respiratory tract, it gets down into our throat, our ears, our lungs, our immune system's like, hold up, you don't belong here. Who is this guy? What do we need to do to fight it? And then the body goes on attack. And a lot of how we experience infections is a result of our immune system getting riled up to the presence of this stranger and trying to fight it off. The problem with COVID is that it causes so much inflammation that the body really just, like the immune system can sort of run amok and do too much in some circumstances. So if our body is in better condition at baseline, if it is in a less inflamed state, then it is better equipped to fight. Also, we want to strengthen our immune cells so that they're better prepared to fight. So we talked about our skin being our first barrier of protection, right? So just hygiene, wash your hands, clean them with antibacterial soap or an antiseptic. We aren't doing surgery, but the rule is still the same. So you want to reduce the burden of virus or bacteria on the skin so that when you go to eat, for example, or when you touch your face, even though we keep saying don't do that, we do it 120 times an hour as humans. And so it's inevitable that we're going to touch our face, that we're going to reach under that mask and scratch something. We're going to reach up under our glasses or face shield and get the little crusty thing out of our eye, right? It's inevitable. So if you're washing your hands, you're disinfecting them repeatedly, then you decrease the amount of bacteria and virus on them, so you can help decrease the transmission of virus. Again, nothing is perfect. We cannot fully eradicate skin bacteria, but in the case of COVID, the virus is literally destroyed on contact when we use high alcohol content disinfectants or when we use soap and water, because it doesn't have a true cell wall, so it can destroy that. So good hand washing, make sure you do it long enough, make sure you scrub your hands vigorously, get under your nails, you know, cut down your nails, because they hold a lot of germs, get into the web spaces, do the front and backs of your hands. Just good hand washing. And then, you know, other ways to strengthen our immune function or our natural defenses are diet and lifestyle. And we've talked about this before, but I think it is very important to reiterate it at this time, because we've been safe at home and we're going out into the world where COVID is out there circulating, and we're about to be at risk for other cough, colds, and flu illnesses. So if you're malnourished, malnourishment increases the risk of infection several folds. Some data suggest like 6-fold. And, you know, if you're malnourished, then your body is in a weakened state. If you're malnourished, you may not produce the right amount of white blood cells or healthy white blood cells. You may not produce the right amount of factors that your body needs to fight infections. Your organs may be in a state of, you know, stress as a result of being malnourished. And I would say, you know, I'll add in with that, hydration is so important to be hydrated. You know, our body is mostly water, and we just tend not to drink enough, or we drink sugar-laden beverages that cause us to pee out more. We drink a lot of caffeine. Y'all see me every day with my cup of coffee. And so I have to be very mindful during the day to replace, and for every, you know, 1 cup of coffee I'm drinking, I try to drink 2 to 3 cups of water above and beyond my normal daily intake, so that I am hydrated. Your body, if you're already dehydrated, if you're already malnourished, and then infection comes in, you're operating at a much greater deficit. When we eat, we want to make sure we eat foods that are nutrient rich. So we don't want to eat processed foods. We don't want to eat packaged foods. We want to try to minimize, you know, pre-prepared foods that are loaded with preservatives or pre-cooked, apart from like blanched frozen vegetables, because foods are, they lose their nutrient value when they are repeatedly cooked or when they're heavily processed and treated with chemicals and preservatives. So fresh fruits as much as you can. Apart from being nutrient rich, fresh fruits and vegetables, good healthy proteins, those foods are more likely to be, well, not so much the meats, but the fresh fruits and vegetables are more likely to be rich in antioxidants. Antioxidants are what we need to fight damage in our body. So antioxidants go in and they clean up what we call free radicals. Free radicals are the byproduct of toxins in our body, the byproducts of cellular damage and breakdown in our body, and they further age and damage our cells. So when we take in antioxidants, they go in and they gobble up all of those free radicals that cause damage and contribute to aging. Fresh fruits and vegetables are what we call prebiotic. So you have heard me talk about the gut. You've heard other presenters talk about our gut health, and in our gut are naturally occurring bacteria, and there are billions and billions and billions of them. And those healthy gut bacteria are part of our digestive system. They are part of our metabolic system. They are part of our immune system. And so if our gut bacteria are off, we are more prone to infection. So processed foods, especially meat and dairy products, will have antibiotics in them. So you will see certain meat products or dairy products saying that the cows or the chickens were not fed antibiotics. That is important because you're exposed to those antibiotics when you eat those food products, and they disrupt your normal gut bacteria. So you want to feed your gut prebiotic foods, so high fiber foods, and you want to even replenish with probiotics. Fresh fruits and vegetables are high in vitamin C and so many other good nutrients that we need to help boost our immune system. And we talked about how the fiber components of those foods benefit us. So again, You can take prebiotic foods or you can take a probiotic supplement. So prebiotic foods are fermented foods, sauerkraut, yogurt, kimchi, kefir, kombucha. So they have live cultures of bacteria and sometimes certain yeast in them, and they encourage the growth of our natural healthy gut bacteria. Sugar, cut the sugar. So sugar in excess, especially processed sugar, increases systemic inflammation. It results in increased weight gain. You know, Americans on average gain like 1 to 5 pounds every single year because we generally eat a very high carb diet. If an American person eats like the average American eats, they eat up to 250 grams of carbs per day. The recommended allowance is like, you know, 50 grams of carbs per day. So we far exceed what we need, and we just basically store it all as excess body fat. That excess body fat produces excess hormones like estrogen, and that's why obesity is linked with increased risk of cancer. It is pro-inflammatory, and that's why we see increased risk of complications due to all infections, especially COVID, where inflammation is a major culprit of the adverse outcomes of the infection and the disease state that it causes. High blood sugar is linked to heart disease, and of course is related to diabetes. So type 2 diabetics, it's a lifestyle-induced diabetes, right? Where we have just worn out our pancreases with our lifestyle and we don't produce enough insulin to regulate our body sugar. High blood sugars causes a suppressed immune system and poor wound healing. So as opposed to having sugar that is in the form of like high fructose corn syrup and sodas and juices and things like that, you want to have naturally occurring sugars that are in, you know, fresh fruits and vegetables, but you also don't want to have too much of a good thing. So cut out the refined sugar, you know, avoid scooping sugar into your tea and coffee. Also, avoid products that are made with high fructose corn syrup. You know, I know that they will put in the commercial that it's okay to have it, it's okay in moderation, but it is not naturally occurring. Like, we don't need juice. We have no need for juice in our diet or our bodies. It tastes good and it makes some people rich, but you know, they advertise to keep us feeling like it's safe to partake in certain things. If you're a smoker, quit smoking. You know, it's hard to quit smoking. It's not an easy thing. You can't just put down a cigarette and now I'm no longer a smoker. But most insurances cover smoking cessation therapies, whether it's nicotine patches, gum, you know, certain medications that cause you to lose the taste for cigarettes or tobacco. And these are safe and effective ways to do this. In New York State, you can actually call 311 and get hooked up with a free smoking cessation plan, and your doctor can help you with this and would gladly help you quit smoking. People who smoke, they're at increased risk for infections, including pneumonia, increased risk of lung complications, such as blood clots as well, and increased risk of wound complications and infections. So people who are hospitalized with COVID-19, they need, you know, catheters for the administration of the medications that they need if they're in a period of critical illness or they can't breathe, so they need fluid hydration. And you know, smoking cigarettes increases the risk of infection even at those injection sites or those catheter sites. So it's so many reasons above and beyond the lung to quit smoking. It also increases your risk of heart attacks and stroke and other cancers. So quit if you can. Exercise. If you have not already, it's not too late. The weather is great. We still got a good solid 3 more months of time we can spend outdoors, walking briskly, biking, jogging, doing aerobic exercise outdoors or in our homes. And in the midst of COVID, you know, people who are in the health and wellness community have been so generous with, you know, free streaming workouts, whether they're live or pre-recorded. Take advantage. You don't need equipment. Like literally, I would describe it as throwing your body around, but it's doing more than throwing your body around. But you can activate your muscles, you can get your heart rate up, break a sweat, do aerobic exercise, and it will only serve your body. Nobody is saying, I'm certainly not saying that you have to, you know, lose all the weight that you want to lose in your lifetime or meet every single weight loss goal that you have, if that's even a concern for you. You can change your diet, change your lifestyle, and increase or start an exercise routine and not lose a single pound and still be in a better state of health before if you were not doing or employing those things. So health is not necessarily a number on the scale. Health is not a particular BMI, because there's a lot of things that contribute to that and falsely elevate that number. But you know, understanding the risk and understanding the benefits of a healthy diet and a healthy lifestyle, you know that exercise improves immunity. Know that exercise decreases and alleviates inflammation in your body. If you're someone who's experienced joint stiffness, right? You've been sitting for a while, or you wake up in the morning and your joints feel stiff and locked up. As you move, you'll notice your joints loosen up. And if you exercise routinely, you'll notice that if you have inflammatory arthritis, your joint pains will decrease in frequency and severity, and that is because you are releasing inflammation as you move your body. Exercise also improves the regeneration of your immune cells. So move your body. Stress, we have learned so many wonderful mechanisms for releasing stress. We've done guided meditation, we've done yoga, we've done you know, movement and meditation, we've done journaling. We have so many wonderful resources in this community. If you missed the early part of the series, you can catch up and learn how to alleviate stress. Stress is real, and stress has real physical impacts. Stress increases our cortisol levels, which is our stress hormone, and then there's a trickle-down effect in terms of the impact of other hormone levels in our body. Stress disrupts our sleep-wake cycles because of the impact on our serotonin levels. It can impact our mood in the immediate short term as well as in the long term. And so we want to alleviate stress so that we don't experience suppression of our immune system, so that we don't experience the physical impacts of stress, and so that we don't tax our body and our immune system. Supplements, right? So there's certain supplements that, you know, we'll often increase our intake of or sort of exploit during periods of illness. So things like Emergency, for example, we take because it's high in vitamin C and zinc. We also use supplements like echinacea and elderberry to support our immune system. One thing I will mention that's specific to elderberry is, although we know that it is great to use during the cough, cold, and flu season, there's some information that sort of suggested in the beginning of this pandemic that it may have been harmful. There's no hard data on that, so we don't know yet, but things that I would absolutely be supplementing would be vitamin C, vitamin D, zinc, echinacea, and definitely I would say elderberry is on the list as well, because we all know that these boost the immune system and then have some natural anti-inflammatory and anti-infection properties. So these are all preventative strategies to boost our immune system and prevent infection. We already talked about exercise. And what it does for our body in terms of releasing inflammation, but it burns calories, it relieves stress, it improves sleep, and again, boosts the immune system. So that being said, you guys may have noticed in the slides that I had some images of some of my supplements, and my supplements are up on the site. Everything works. I have gifted some supplements. I've had some purchases of the supplements from the community. And so I thank you all so much for that. And my gift to you for joining me today is 15% off any supplement on my site. So you can go to my website, dralexea.com. If you go to the supplements tab, you will see my supplements. They're listed in alphabetical order. In the midst of cough, cold, and flu season, for us as Black and Brown people, especially those of us living in the Northeast, we tend to be very vitamin D deficient. So certainly would encourage you to consider supplementing your vitamin D. Have some great vitamin C and zinc supplements on the site as well as formulas that boost immunity. If you're not certain what it is that you need, I would definitely encourage you to reach out to me for a consultation, and we can talk about your health and your needs, because it's important when you're taking supplements that you don't just purchase random things, that you take things that serve your body, but you know, you want to run these things by your medical doctor, your healthcare professionals who take care of you, because sometimes even supplements can interact with other medications you take. You may not be a good candidate for a certain supplement if you have, for instance, chronic kidney disease, or let's say you're on blood thinners and you're going to take a vitamin D supplement. You want to just take straight vitamin D, not vitamin D packaged with vitamin K. So there's a lot of little nuances to utilizing supplements, and we want to make sure we're taking them in a way that best serves our body and does not impact our health. So again, my special offer for the Wake Up community is 15% off. The supplements are live, the site works, everything is up and running on dralexea.com. Go to the supplements tab, and when you check out, there's a space where you can enter a coupon code, and that coupon code specifically for the Wake Up community is Wake Up 15 in all caps, okay? That being said, I thank you all so much for your time and attention. I definitely want to give an opportunity for questions and answers. We have 8 minutes left, but we also want to make sure that we leave time to share what's up next in the Wake Up community.
Thank you so much, Dr. Alexea. That was a lot of good, helpful information about how we can protect ourselves, protect our bodies, protect our health from COVID-19. So there were a couple of questions that I will share with you.
Awesome.
One of the questions was, you talked about risk factors in the beginning, and high blood pressure and asthma are some of the risk factors that are reported as high risk factors in our communities. Can you talk about how those conditions impact a person's immune system? And then the other question was, are vitamins, herbs, and oils helpful in warding off stress, flu, and possibly COVID?
Yeah, so high blood pressure is a huge, huge, huge risk factor for COVID-19. It kind of tops the list. And, you know, high blood pressure is just in general a stress on the body. You know, we have higher blood pressure in Black and Brown communities for multifactorial reasons. Definitely some of it is stress, like living in a constant state of stress. We tend to be more likely to be overweight and obese, which also contributes to high blood pressure. Depending on your dietary habits and your culturally, like the way we prepare food has not always been the healthiest. And that is because, you know, for years we just worked with what we had. And now we may find ourselves living in food deserts where we don't have fresh food markets, where our grocery stores don't have fruits and vegetables that are in great condition, and the food may be financially out of reach. And our communities tend to be inundated with, you know, fast food restaurants, McDonald's, Burger King, Popeyes, Little Caesars Pizza, food that is fast, that is cheap, and doesn't serve our body, full of salt, full of fat, full of and lacking in nutrition and contribute to high blood pressure. So because of the stress on the heart and the stress on the system and damage to all of the vital organs, high blood pressure places people who become infected with COVID-19 at a greater risk for adverse outcomes. The risk with asthma is multifactorial. So you are more likely to be asthmatic if you live in a city, if you live in densely populated areas, if you live in communities where there's a lot of air pollution. So think about the city, right? High density of traffic, high density of public transportation, high density of trucks around, and in that environment is everything that's being given off by the engines of those vehicles, brake dust, you know, motor oil, all kinds of things just in the air, and that damages the lungs even before a child or person is born. And then the continued exposure leads to ongoing inflammation, damage, and reactivity of the airways. Some children will develop asthma or reactive airway disease as a result of viral respiratory infections that they had when they're very young. And the reason why that is a risk for COVID is because the lungs are basically in an inflammatory state. So when a virus is introduced, especially COVID, that produces even more inflammation, the airways react by becoming inflamed. And when they inflame, what happens is they're not swelling in such a way that they're more wide open, but they're becoming constricted. So like the amount of space that you have to breathe through constricts. Lots of inflammatory fluid is dumped into the airways. That is what we cough up as mucus. And it contributes to wheezing, shortness of breath, and it is a risk for respiratory failure and lung infections. So COVID-19 on top of an already compromised lung because of asthma can just wreak havoc and push someone into respiratory failure, an adult or a child, so they're more likely to be intubated. And asthmatics often have to take steroids to keep their disease under control, and you know, it can be relatively immune suppressing. That being said, if you're asthmatic, I'm certainly not saying stop any of your oral or inhaled steroids, because you need those medications to keep your asthma at bay. Asthma is a deadly condition, and Black and brown people are more likely to die from it and be hospitalized from it, especially if we live in the city and densely populated areas where there's a lot of air pollution. So in the Bronx, I collaborated with an environmental protection organization, and we talked about the impact of environmental pollution, asthma on that community in COVID-19, and it contributed very significantly to the increased number of deaths in that community. And I'm sure the same could be true for areas of Brooklyn and Queens, where we have higher asthma rates as well.
Thank you for that. And then final question about the herbs and oils.
Oh, yeah.
Supplements.
So we can definitely utilize herb supplements. You know, I know people take things like oil of oregano to help boost the immune system, decrease systemic inflammation. And we know that herbs have naturally occurring antiviral and antibacterial properties. So people can use them as preventative strategies. But in terms of like comparing them head to head to certain medical therapies, you know, from what I see from data, and the data may be biased, typically if you are really sick and you need an antibiotic, if you should seek medical attention that you need and that you deserve, right? Get the treatment that your body needs. So if you're having progressive symptoms and progressive infection, even in spite of using those preventative and natural treatment strategies, then I would definitely encourage you to seek medical attention. So in the midst of COVID, if you're really having trouble breathing, you can't speak full sentences, you're gasping for air, if you observe your loved one to be belly breathing, you know, having waxing and waning, you know, levels of alertness, like they're overly drowsy, overly sedated, they're looking pale, their lips are blue or dusky or purple, then get in and get medical intervention. Like that's not the time or the state where you want to be relying on ways of taking care of ourselves, but we also want to use good sound judgment and seek emergency medical attention or even non-emergency medical attention when we do need it.
Thank you very much, Dr. Alexea. This was chock full of great information. We are going now to remind people about your special offer, if you don't mind.
Absolutely.
And we will move to letting people go.
Okay, so again, Wake Up community members, you guys can get 15% off any supplement on the dralexea.com website. Remember, you're using the code WakeUp15 and it is all capital letters. You can go to the next slide, Nigel. Again, you guys know how to find me. I keep it simple. It's Dr. Alexea across all social media platforms. I'm predominantly on Facebook and Instagram. You can email me at agaffneyadams@gmail.com. And then you can check out some health information on dralexea.com. I'll be uploading some blogs about COVID-19 and some articles that I wrote and about flu in the coming days and weeks. And then again, for love offerings and donations, we always appreciate your generosity here in the Wake Up community. You can donate to myself or provide a love offering to myself, as well as my wonderful admin team that was here with me today through Zelle and QuickPay. So soulleadershipdevelopment@gmail.com for Zelle and QuickPay. And then the Cash App is $WUE for Wake Up Everybody Community. So WUE Community on the Cash App, and the code is #141AG repeat, because this is our second go around. I am so grateful to everybody who rejoined us in the space. We invite you to stay in touch with us here in the Wake Up community. If you haven't already registered, join by doing bit.ly Wake Up Movement. Join the Facebook community at bit.ly/WUE community. Follow us on Instagram at Wake Up Series, and then follow Wake Up Everybody on YouTube. So WUE on youtube.com. And then you can email for info at enjoying all the wonderful content and what's coming up for us in the Wake Up community. Join us Sunday, September 6th in the Zoom space. So join us back here. Zoom to Facebook on Sunday. The Chrysalis of Love Part 2 with Candace Harper. I was in her first Chrysalis of Love series, and it was really great information. So please do join us there. And then on Monday, September 7th, Zoom streaming to Facebook. Our own John Carl Martin, who is adminning with us today, Energy Flows Where Your Attention Goes. That is going to be powerful. I always tell people, like, you know, your mind is so powerful, and so what you think is going to be, what you say or what you believe about your body is what's going to be. So tune in for that. Don't forget the new Wake Up schedule. So our Zoom live workshops are Sunday, Tuesday, and Thursday, 7 a.m. to 8:30. Today is a special event to do the repeat. And then on Mondays and Wednesdays, 7 to 7:30, we are in the Facebook community. So live streaming from Zoom onto Facebook. So join us in the Facebook community on Mondays and Wednesdays. That being said, we are going to let you all get to your Saturday. Again, thank you for tuning in, and thank you in advance for sharing your love. Thank you for all the questions, all the comments, for being active in the chat. I always love the community for just making sure that I speak outside of my, traditional hospital box, and that we are in partnership with encouraging one another and being in a place and state of total health and wellness.
Thank you again, Alexea. Thank you so much. This was really great content. We appreciate it. We appreciate you. It is now time for us to come off of mutes and shower our dear doctor with love and appreciation, and thanks for making time again to share this information with us.
Thank you, beautiful. Really
Thank you. Thank you.
Thank y'all.
family, love you, Shawnee, and Mint team. Have a great night.
So much. I appreciate you so much, and thank you so much for coming back again to do this presentation. And thank you from Robin too.
Thank you, Kathy. Thank you.
Thank you so much for reading this. This was so good and useful information. I really appreciate you taking the time to do this for the community.
Thank you. I appreciate you tuning in.
Thank you so much. Priceless information.
Thanks, everyone.
Thank you.
Thank you so much,
Dr. Alexea.
Thank y'all.
Thank you. Thank you for your compassion. Thank you so much.
Oh, thank you.
Thank you. We know it's from the heart, so we appreciate it more. Thank you for looking for us. We would not, even in our medical offices. So it is a joy to know that we can come to the Wake Up space and hear your voice and know that it's from a genuine place. And I don't take it lightly, and I'm sure the community doesn't either. Thank you.
Thank you. Thank you so much. You are so appreciated, so knowledgeable, and we know that you care about us. So I appreciate everything that you've done. Thank you so much, Doctor. Have a wonderful, wonderful weekend.
Thank you.
Stay safe, everyone.
Yes, everybody be safe. Have a safe and enjoyable weekend.